When you look at healthcare and life sciences in general, it really is one of those recession-proof industries. People are getting sick. People get sick worldwide. They need better medication. They need faster medication. They need more access to therapeutics, diagnostics, devices. And regardless of whether we're in a major pandemic or whether we're in a major recession, we still have people that are getting sick. And so all of our groups in this space, whether they be healthcare firms, life sciences firms, they have to continue to innovate. And innovation in medicine is precision medicine. It is the future of medicine. It is generative AI. It is putting together a number of different types of pieces of the ecosystem so that we get to our patients faster. So you are absolutely right. Both inorganic and organic strategies are absolutely essential in this space. And that is what we have seen throughout the years, even as the deal market has softened over the past couple of years.
I want to get more into that innovation that you were talking about. I hosted a panel for Bloomberg. It was about AI, and one of the companies there was healthcare, and they said AI is playing a big part. It is a game changer. So if you can get a little bit more into that for us.
Absolutely. And it's a game changer across all of the different subsectors of healthcare and life sciences. Remember, there are a number of different groups that are playing into this ecosystem. Our pharma companies need generative AI to really help take their rapidity of their pipelines, make everything going through the pipeline a lot faster, a lot more efficient, a lot more effective. Our health systems are using it both in the front office and the back office to take all of the patient data, all the patient claims, everything that they're getting hit with, and develop new patient journeys, new sample journeys for those patients to get them better and more effective therapeutics. And what I would say is that over the last year alone, the amount of time and energy and diligence that has been spent on generative AI, the companies, the partnerships, how we're even dealing with the space has just gone snowballed throughout the industry. And so we're getting more and more questions on that every day. I would say that the amount of deal making, actual M&A in generative AI is less so than the partnerships and all of the questions around generative AI. But in 2024, we expect that to increase.
So what is precision medicine exactly from your perspective?
Absolutely. Precision medicine is the best therapeutic or care for the best patient at the best time. And so when you think about that and you think about what I just said, it isn't a buzzword, it's the future of medicine. We want to be able to take one patient, look at that patient, and provide them the most effective and efficient care. And so that's what we see. And when we take that precision medicine out to precision healthcare, it adds in the entire ecosystem, whether it be the diagnostics that surround those therapeutics, whether it be the patient services, and whether it be in a domestic market or a worldwide market.
Now, talk to me about hospitals. They're facing these big financial pressures. You have workers, there's a shortage of workers. How is this going to change the industry moving into 2024?
Absolutely. Both generative AI and precision health happen to really help what you just mentioned. When you think about how many workers we have to put in the workforce, when you think about how many therapeutics that we need to save people's lives, if we can get more precise diagnostics, more precise services to our patients in a quicker amount of time in those health systems, that allows us to take our workforce and refine our workforce to only who we need. It also allows us to upskill our workforce, maybe with bringing in people that could be upskilled faster through generative AI approaches, and then allow us to manipulate and change our workforce to better suit the needs of what we need in the future.
All right. So from a deal perspective, Kristin, what sectors do you think are going to be most in play over the next 12 months?
When you look across healthcare and life sciences and you look at the lows of 2023 and you look at what's recovering quicker, each one of the subsectors in life sciences continues to be very exciting and for different reasons. Within biopharma, the innovation around cell and gene therapy, within a lot of our other biologics, within companion therapeutics, is continuing to move us through the pipeline and look at deals that are continuing to change the portfolio of each one of our pharmaceutical companies. When you look at diagnostics, we had a little bit of a lull last year, of course, as our diagnostics companies went into the new normal post-COVID, but now they are looking for interesting point of care, interesting innovations within diagnostics to help pharmaceutical companies and to help services in better ways. Devices are always going to be one of those areas where we keep on looking to say, is this the year? Device companies had a harder time during COVID, of course, as elective procedures really tanked. All those elective procedures, hips, knees, et cetera, all have come up again. And now, as our health systems continue to promote those elective procedures, continue to bring them in, our device companies are looking very carefully at new innovative ways that they can bring new devices to the fold and emerge as the victors in that particular area. In healthcare, when you look at health systems, when you look at payers, well, and when you look at physician groups, we're seeing health IT and physician groups as being the most exciting areas, and continued consolidation and thoughts on health systems as the health systems continue to recover from COVID and really be very thoughtful about their costs paired with the innovation that they're seeing from life sciences. Life sciences and healthcare are inexorably linked sectors. And so as we look at this overall, we're continuing to see the dynamics between innovation between those two teams.